A lot of information about hepatoprotective role of UDCA has been presented during the previous lectures today and yesterday, so please forgive me if some of this information will be repeated during my lecture. However, it is inevitable and it is necessary to present the whole of topic of my lecture. Ursodeoxycholic acid is a naturally occurring bile acid found in the bile of the Chinese black bear. In bear, UDCA is synthesized by hepatocytes and represents the largest part of entire bile acids pool. UDCA name comes from the word ursus, that in Latin means bear. And Chinese black bear bile has been used for many, many years by practitioners of Eastern medicine and then has been commercially synthesized and available as a hepatoprotective agent in Japan since the 1930s. Since the 1970s, UDCA has been used in Western human medicine. We can talk about UDCA very much because the problem is very wide. However, due to limited time frame, please allow me to focus on the most important problems. Physiologically, in human bile contains of bile acids, phospholipids, and cholesterol. There are two types of bile acids distinguish primary and secondary. As you have a look at this slide, you can see that we have four main bile acids. Two of them, cholic acid and chenodeoxycholic acids, are synthesized in hepatocytes by cytochrome P450 mediated oxidation and then stored in the gallbladder. While lidocholic acid and deoxycholic acids are synthesized, are made in the gut by intestinal bacteria. The main bile acids have different physicochemical characteristic and biological properties, in particular hydrophilicity, that differentiate them. The most hydrophilic is cholic acid, at the least is lidocholic acid. The main important feature of bile acids is their toxicity, and toxicity is in opposite to hydrophilicity, and lidocholic acid is the most toxic, while the lowest toxicity is demonstrated by cholic acid. In human bile, there are another bile acids which are called tertiary bile acids, and they are metabolites of main bile acids. Their concentration in bile is relatively low. However, it may be changed in pathological conditions or after exogenous administration, affecting significantly on the properties of bile. UDCA is one of the tertiary bile acid and has beneficial role in treatment of many different liver and biliary diseases. UDCA is formed as a result of hydroxylation of chenodeoxycholic acid to lidocholic acid by microbiological transformation and further metabolism in the liver. UDCA constitutes 3 to 5% of all bile acids, and 60% of UDCA is metabolized during the first pass through the liver, where it is conjugated with glycine, sometimes with taurine, and conjugated UDCA is secreted into the bile and in terminal region of the ileum is again resorbed to enterohepatic circulation. In comparison to all bile acids, UDCA is the most hydrophilic and the least toxic. It results from its spatial structure and localization of hydroxyl group in the 7-beta position. UDCA shows pleiotropic activity, mainly anti-apoptotic, anti-inflammatory, immunomodulatory, choleretic, and cytoprotective effect. And here you can see all potential activity of UDCA, which may be helpful in treatment many different liver diseases. From the long list of potential mechanisms of activity of UDCA, there are three the best documented ones, and they include protection of cholangiocytes against toxic effect of hydrophobic bile acids, stimulation of bile secretion in the liver, and protection of hepatocytes against apoptosis, which is stimulated by other bile acids. The beneficial role of UDCA is related to its influence on the composition of bile. The increase in UDCA concentration in bile leads to formation micelles that contain less more toxic ursodeoxycholic acid. Due to its properties, UDCA is applied in different liver diseases, mainly cholestatic and parenchymal liver diseases. Literature data demonstrated that UDCA may be helpful in treatment of cholelithiasis and choledocholithiasis when stones are located in bile ducts, usually prophylactically after acute biliary pancreatitis, after endoscopic removal stones from biliary ducts. UDCA can dissolve cholesterol-rich stones and can prevent forming of stones in obese patients with losing weight rapidly. Literature data also demonstrates that UDCA is helpful in treatment of biliary gastritis. And now I would like to stop and discuss the role of UDCA in treatment of cholelithiasis. We all know that cholecystectomy is procedure of choice in patients with symptomatic cholelithiasis. However, the attempt to dissolve the stones may be considered in selected group of patients where the patients fulfill all here presented criteria. The recommended dose is between 8 to 10 milligrams per kilogram of body mass per day. And the main problem is that the solution of stones is very, very slow process. It is about 1 millimeter per 1 month. So the therapy is long-term, is high cost, and we should remember that effectiveness of this therapy does not reach 100%. If the stones are numerous, approximately 50% of patients relapse. UDCA is applied in prevention of biliary cancer in primary sclerosis cholangitis. This topic was discussed by the previous speaker. I told only this, that the recommended dose is between 10 and 15 milligrams of UDCA per kilogram of body mass per day. Higher doses were tested, however, they do not produce any improvement in mortality and in reduction of cholangiocarcinoma. UDCA may be helpful in prevention of colorectal cancer in patients with PSC and inflammatory bowel diseases. Firstly, the dose of 10 to 15 milligrams was recommended, but it may be interesting that in 2011, a multi-center placebo-controlled study was published. In this study, higher doses of UDCA were used. It was between 28 and 30 milligrams of UDCA. And this study shows different results, that in patients with PSC and ulcerative colitis, the incidence of dysplasia in colon increase. So this topic is still questionable, is still discussed, but EASL European of Study for Liver Disease allows to use UDCA in recommended doses in patients as prevention of colorectal cancer in patients with PSC and IBD, but American Association is negative in this matter. Literature data show that UDCA may be helpful in prevention of esophageal cancer, mainly in patients with Barrett esophagus. The main recommendation for use of UDCA is primary biliary cholangitis. UDCA improves clinical symptoms, liver function tests, and gives better histological results. In the patient with early stage of disease, present better improvement in histological results, in biochemical and clinical results in comparison to the patients who remain in late stage of diseases. So the UDCA is recommended in all patients with PSC, even with normal results of liver function tests. UDCA delays the need for liver transplantation in patients with PBC and delays the death. Its role in patients who are in late stage of disease is still questionable. The therapy should be conducted the entire course of the disease until its intolerance, and here you can see potential activity of UDCA, which may be used in therapy of primary biliary cholangitis. Liver function tests should be repeated every 3 to 6 months during the entire therapy. Let's now move on to non-alcoholic fatty liver disease. It is the most common reason for irregular liver function tests in development countries. Due to its continuously prevalence, the disease is considered an epidemic of 21st century. It is estimated that NAFLD can affect nearly 30% people in the world. Clinical spectrum of this disease include simply steatosis, potentially reversible condition, steatohepatitis, non-alcoholic steatohepatitis, fibrosis and cirrhosis, which is an independent risk for hepatoma development. Anti-apoptotic, anti-inflammatory, cytoprotective, and immunomodulatory activities are the main action of UDCA, which may be helpful in treatment of non-alcoholic fatty liver disease in mainly non-alcoholic steatohepatitis. They lead to reduction of TNF-alpha level, to reduction of oxidative stress, and UDCA in these patients reduce insulin resistance, which plays the crucial role in pathogenesis of NASH. NASH patients treated with UDCA at a dose of 10 to 15 milligrams per kilogram per day shows improvement in biochemical results. And intrahepatic cholestasis of pregnancy is the specific pregnancy-related disorders occurring in late second and third trimester of pregnancy. And clinical and biochemical characteristics of this disease include unexplained maternal pruritus and elevated serum of transaminases and elevated level of fasting serum bile acids in previous healthy pregnant women. UDCA at a dose of 15 milligrams per kilogram of body mass per day improve mainly pruritus and reduce liver function tests and has beneficial role for the fetus. The medication is well tolerated, has no side effects, also for the mother and also for her babies. Ladies and gentlemen, we can talk about the hepatoprotective role of UDCA very much. But I try to summarize, I try to present the most important problems concerning this topic. I realized that they do not cover all issues. However, it was impossible to present much more issues much more information concerning this, topic. We know that UDCA can be applied in cholestatic forms of DILI, sometimes may be applied in alcoholic liver diseases, in many congenital biliary diseases. And now I would like to summarize and present the conclusion. Firstly, UDCA shows anti-inflammatory, anti-apoptotic, cytoprotective, and immunomodulatory and choleretic effect, is effective in treatment of selected parenchymal and cholestatic liver diseases, is recommended in all patients with primary biliary cholangitis, may be helpful in the therapy of non-alcoholic steatohepatitis and intrahepatic cholestasis of pregnancy. And more conclusions may be considered in the selected group of patients with cholitisis and choledocholitisis, has a chemopreventive effect on biliary cancer and colorectal cancer development in patients with primary sclerosing cholangitis and ulcerative colitis. UDCA is safe, is well tolerated in long term and standard doses therapy. So thank you very much for your attention.